25 again, perhaps some of this message resonates with you. Perhaps you'd like to be healthier, more energy, sleep better. All of this is available to you now at a very special deal of the day, Lisa.
Absolutely. Pay attention now. There's actually two specials. It's half off your consultation fee. That's a lab draw. And then a week later, you come back for a 1-hour analysis of your lab work. And again, this is if you're interested in the hormones. Normally it's $150. Today it's just $75. Go to 25again.com/wave3 to purchase, or give us a call. Please be patient. I know those girls are super busy when we do the show. The phone number is 425-0500. And in addition to this deal of the day, Tasha has so lovingly decided to give a 15-minute free consultation with her if you want to just get some more information and find out a little bit about what she does and what she can provide, which I'll let her elaborate on.
Absolutely. So I am excited to be able to do this. I'm going to be talking with members for 15 minutes, just letting them know you know, I want to hear from them. I want to hear where they're at, what their goals are. So what are your goals, and how can I match you up to a service I have available? Because we have a lot of different package deals that we can do, and we would love to get you in and get you started on a personalized plan just for you.
You know, it's nice to have all of this expertise under one roof, because Jennifer, for you as a nurse practitioner, and then Tasha as a licensed dietitian, you two can talk about a certain client, and you can say, okay, member, and you can say, hey, you know, let's make sure that we're on the same page here. I think this. And you can go, well, her lab showed this, and you guys can go back and forth, right?
Absolutely.
That's a nice advantage, because sometimes there's, you know, things like iron deficiencies and things that you can provide via diet and that she's aware of with the lab, so you guys go back and forth, and it's a team effort, right?
And you would be very, very surprised how many people come in and they either haven't been to their doctor in a while, or they don't get a comprehensive lab work done, and they have no idea that they're insulin resistant or pre-diabetic, and so they're obviously not eating right or doing the right things, and they're very, very surprised. We want to prevent you from having to go on any of those medications that your body might reject, or if you're already in that state, we want to try to reverse that. Again, that's what hormones do. And again, I also want to mention that we do them bioidentically, not synthetically. That's a big, big difference. We match molecule for what your body makes so that you don't reject it over time. If you go to your regular physician and he or she prescribes you a hormone and they say that it's synthetic, I can promise you they will only leave you on that for about a year or two, and then they will bring you off, because studies prove that those things can set you up, but synthetic hormones can set you up for cancers and other things that you obviously don't want to have to deal with. Bioidentical hormones you can be on for a lifetime. We also have a pharmacy. If you're sitting there scratching your head going, well, my physician's already given me my bioidentical hormones. I am doing it right. That's fine. You may use our pharmacy. You just call up your physician and let them know, new Vitalis. Guess what? It comes straight to your door within 24 hours. I mean, how much more convenient can we make it for you?
And I think that's great, because to me it is all about convenience. It's a big component, because how much time do I have?
Busy.
Yeah, I don't have time to keep running back and forth to a pharmacy. If it arrives at my door, good. That's all
and if
good.
you're doing bioidentical, you have to go to a compound pharmacy. So if you're getting something from a compound pharmacy, they may not have your other prescriptions, so you have to go to both. So again, that's why we made it very, very simple. 24, sometimes 48, it depends on what time of day, but generally within 24 hours, you're going to get your meds delivered right to your door.
Okay, if you have a diet question, of course, Tasha is here to answer those. And of course, we've got the team of Jennifer and Lisa from the medical side, because we don't say this a lot, but Lisa's also a registered nurse. So if you have a question from the medical side, 571-5263. I have the team here. So I'm going to go bounce back and forth. I want to ask you, Jennifer, if you would. Okay, so the fact that you're a nurse practitioner and HCG, so I can talk to you about the safety of. I know that's important to you. So for those, I'm playing devil's advocate here.
Absolutely.
So for those who say, is it safe? I mean, you lost 21 pounds. Obviously, it works. Tell me about the safety component.
Well, that's the importance of being monitored, you know, the weight loss monitoring program. We encourage the patients to come in weekly. We do biomarkers. We check their blood pressure to make sure that there's been no increase or decrease based on the amount of weight that they're losing, or anything that they're taking. And then and that also adds that little layer of accountability. So you're coming in, you're making sure that they're following the diet. We can also address any pitfalls or anything. If they stall on the diet, they may be doing something incorrectly, because a lot of times some people will like to substitute things that they maybe shouldn't on the diet, or they may have cheated, and it's just a way to keep them on track. But yeah, safety is a big issue, and that we we make sure that we're paying attention to.
And it certainly works. It expedited everything. How long did it take you to lose 21 pounds?
The 21 pounds, it was a total of about about 5 weeks.
Wow.
So,
Not too shabby.
It's motivational.
Yeah, that works.
Very motivational.
That works. And Tasha, for you, I have found, and Lisa and I talk about this often, that positive snowball effect. So they're losing the weight, they come to you for the diet, and suddenly they're all in because they see results. And that's something that's probably lacked with other programs. It's like, I want to see results, and I want to feel better. When they start feeling this, they're probably more open to what you have to tell them, right?
Absolutely. It is much easier to keep somebody engaged who has actually seen results, and then they can continue with those healthy habits moving forward. It's easier because they do feel good, right? So that's what we want to do. We want to get them kick-started on their weight loss and then help them really make some of those lifelong habits ingrained, something they just do because they feel better doing it.
Interesting.
Yeah.
So I want to talk a little bit more about this new a la carte and some of the services that you offer, Lisa, because I'm sure there's a lot of folks watching going, okay, maybe they're interested in hormone therapy, but maybe they're going, I have some other things I'd be interested in. Tell me about your menu.
My menu of services is getting longer and longer as we speak. I happen to be a licensed Botox injector, so I do that at several of our offices. And again, you can just call. It's just $10 a unit for our members and $11 a unit for non-members, which is very, very good deal. I've been injecting for 7 years. I have done some advanced training, so I consider myself a very good injector, if I do say so myself. We also just added an acoustic wave device, and I'm going to have Jennifer talk about this here in just a minute, because it is certified for several things. Men, ED, that is absolutely, all kinds of offices are using this. Pain, joint pain, shoulder pain, and Jennifer's husband just experienced a treatment, and go ahead and tell them about his experience.
So he has had 1 treatment so far and really positive results. He, after the treatment, said that he could feel a definite difference, and then over the weekend, no pain. So we're really hopeful, and to see, because he'll have a total of 6 treatments. So we're hopeful to see what the results will be. And
so this
and
is
you said
the
he was a
device.
skeptic before.
He was really
one to.
I wasn't going to say that and throw him under the bus. But he was a skeptic going in.
Sure.
So and he was really, really pleased with the results after.
So this is new technology, and now from what I understand, it's my understanding, it's very surface, but it's some kind of sound wave. Is that how does it work?
It's called acoustic wave. It's very new. I'm not certified in it, so I would like to have Richard on next and have him talk more about it and the results that he is seeing. But I know other physicians' offices are doing it and have had great success with it. So we decided, so many people come into us and they're having these type problems. They're having pain, and so and obviously erectile dysfunction is part of what we do. The hormones can absolutely help that, but so can this machine. So again, the community asked us, hey, why don't you have these things? Why don't you do this? How come you guys don't do this? We were so focused on hormones for so long, and again, that is near and dear to my heart because of my family history. My husband has diabetes on his side. I want to prevent that for him, me, our children. I want to age gracefully as I can. But again, there were so many services that I think we were missing out on, and some people either can't or don't want to become a member, possibly can't afford it, and that's okay too. Again, just for $75, you can come in and learn about everything. You can learn about what 3 pages of lab work was going to tell you what is going on in that body. Why am I not sleeping through the night? Why don't I have the energy that I used to have? Why don't I feel like I did? Why can't I lose weight like I used to? What is going on? And those 3 pages will tell your story. And here's a perfect time to take advantage of it, because normally it's $150, and now today it's $75. Again, those are some symptoms of the declining hormones. Not being able to sleep, stress. I was on antidepressants after my mom died, tried to get off of them, could not make it happen. Once I got my progesterone levels straight, have not looked back, have not taken it. Progesterone is what my body makes. An antidepressant, Lexapro, some of the other ones, I always look at people and say, what was your last Lexapro level in your blood? Huh? You don't have it. Lexapro, you don't make Lexapro. You make progesterone. Women, you make testosterone as well. Estrogen in some cases, unless you're postmenopausal or you've had a hysterectomy. We look at magnesium, DHEA. We look at thyroid. And we look at the thyroid very, very closely. A lot different than most physicians. Not only the TSH, but the T3 and the T4. T3 being the key component there, because that's the only form of active thyroid that you have in your body. So many people come to say, my physician said that my thyroid's normal. And we usually just kind of chuckle because it probably isn't. Not that we haven't seen it normal, but it probably isn't. And there's so many different medications that we can provide that's perfect for you. Like Tasha was saying, everything is individualized. Everything is personalized.
Yep, once again, safe and natural. That is the key. Let's go to the phones. We asked for phone calls. We received one from Yvette. Yvette, thank you for watching. Welcome to Wave 3 Listens.
Thank you for taking my call.
You have a question?
Yes, I am a post-menopausal woman, and we have a lot of cancer in our family. I've gained weight, can't sleep, all this stuff. But I've heard that hormone replacement is not safe for African American women and that it can possibly cause cancer.
Would you like to address, or do you want me to address it?
Sure. Well, it depends on if you've had cancer before. We obviously screen and make sure that you've not had any in the past 5 years. Otherwise, we would not treat you. Testosterone and estrogen, if you were appropriate for that, we wouldn't start that until we talked about the side effects, that type of thing. But testosterone doesn't cause cancer. It's the estrogen that can actually feed an existing cancer. So we make sure that, again, you've been screened properly and that we don't just start the medications. Safety, again, is one of the main things that we pride ourselves in, I guess you could say. So,
and I'd like to point out, too, probably the reason you've been told that it's not safe for you, so many women have been told for that because a lot of physicians know only about synthetic hormones, and what we do is bioidentical. So, yes, synthetically, that is something that you would want to stay away from. Bioidentically, if you're a good candidate, that is something that you would want to do to actually help prevent. There are so many people out there that don't understand it. There was, so many myths from when the synthetic hormones came out, and the big rage was to take those, and then all of a sudden these women ended up with cancer. Well, I went to a conference. I listened to an MD speak one day, and she said, I had to stop being an OBGYN, seeing young women, putting them on birth control, which is synthetic hormones, because I was doing nothing but setting them up for cancer. So it is definitely worth your time to come in. I absolutely think that you would be a candidate. At Brownsboro, if you'd like to see Jennifer, she's at our Brownsboro office.
There we go. Yvette, thank you for the call. We'll field your calls as well at 571-5263. Quick break. We'll be back after these on Wave 3 Listens. We're live.